Hi, I'm Kumbi Costa. I am a nurse practitioner. Thank you for choosing UI Health for your surgery. Today I am here to talk to you more about what to expect after surgery. Pain is expected after joint replacement surgery. Your care team will work with you to create an individualized medication plan to manage your pain. You should not drive while taking pain medications. Although it might hurt when you first start moving, movement is actually important to help the surgery heal and to reduce pain and swelling. Try to time your pain medication about 30 minutes prior to exercise or walking so that you are more comfortable when you first get started. You will discharge from the hospital with personalized oral pain medication plan. Take the medication only as directed and on schedule before the pain gets severe. Deep breathing, movement, elevating your leg, and icing will also help manage your pain. It is also expected that you will have swelling for a couple months after surgery. You can limit swelling by elevating your leg above your heart for at least 30 minutes 3 times a day. Also, apply ice to your leg for 10 to 20 minutes with a cloth barrier between the ice and your leg. Be sure to check your skin often. You should ice your leg 3 to 5 times a day. A complication of any surgery can be a blood clot. Blood clots form when blood cells stick together. Blood clots can form in one of the deep veins of your leg. These clots are called deep vein thromboses, or DVTs. A blood clot that travels to your lungs is called a pulmonary embolism, or PE. DVTs and PEs can cause additional medical problems or death. In order to prevent blood clots, we follow the 3 M's: movement, machine, and medication. The first M is movement, such as walking and leg exercises, which help your blood flow. You should walk at least 3 times a day. Ask for assistance when you are getting up. The second M is machine. You will have compression sleeves on your lower legs and feet while in the hospital. These sleeves are connected to a machine that pumps it up with air, massaging your lower leg and helping the blood flow. You should have the machine on whenever you are resting in bed or in the chair. Ask for assistance to put these on or off. Finally, the third M is medication. You will be prescribed an individualized medication for blood thinners. A common blood thinner is aspirin. It is very important that you take this medication as ordered and do not skip any doses. You will continue these medications when you return home. Next, let's talk about the incision from your total joint replacement surgery. For a knee replacement, you will have an incision on the front of your knee. For a hip replacement, you will have an incision on the side of your hip. After surgery, you will have a thick dressing on your incision that you will keep on for 7 days. The dressing may look waterproof. However, we recommend that you cover your incision and the dressing with a plastic bag while showering to keep it dry. You should not submerge your leg in water, only take showers. After 7 days, you will remove the dressing and leave the incision open to air. Do not scrub the incision and do not submerge in water in a tub or pool. Pat the area dry with a clean, dry towel. If you have sutures, these will be removed at your first appointment with your surgeon about 2 to 3 weeks after surgery. Finally, let's talk about the signs of an infection. You should call the clinic if you have any of the following symptoms. 1. If you have a significant increase in pain at your incision that is not relieved with pain medication and is different than the previous day. 2. If you have new or increased redness at the incision site. 3. If you have a large increase or new drainage or foul odor from the incision. 4. If you have a fever that is greater than 101.5 degrees Fahrenheit for 2 consecutive readings at least 4 hours apart. These are all signs of possible infection and are reasons to call your doctor. We are committed to delivering you expert care, and we are happy that you chose UI Health for your joint replacement surgery.